Hello, my name is Trina Rose Fox, and today I'll be performing the skill video of tracheostomy care. I'll start by entering the patient's room, providing patient privacy, hand hygiene, introduce myself to the patient, and verify with two patient identifiers with their wristband. I will make sure that that is raised in a good working position and that it is in Fowler's or semi-Fowler's position. I will also provide suctioning if needed. Next, I will put on clean gloves, and I'll remove their oxygen and their soil dressing into the trash, and gloves into the trash, hand hygiene again. I will open my care kit and I'll take out my sterile gloves and the sterile sheet, ensuring to only touch the shiny side, and that side will also go down. I can also touch the 1-inch border. Shiny side down. I will then dump the contents onto the sterile field. Okay, and then I will fill the compartments. The largest compartment will have the soaking solution. The two smaller compartments will have the sterile saline. And now I will put on my sterile gloves, ensuring to only touch the 1-inch border of the flaps. And then we will discard, just touching from the center into the trash. We'll keep our hands above our waist level and above our elbows to ensure sterility. And I will say that ideally in the real world this will be a 2-person procedure, but for the sake of the video it will just be 1 person. So we will always want to ensure that we stabilize their trach. So first we are going to remove the inner cannula with the curvature and place it in the soaking solution. And then we will place the applicators and now we will scrub the inner cannula. And place the inner cannula in the sterile saline to soak, and we will toss the brush into the trash. And now we will replace the inner cannula, making sure it's locked into place. And then we will go ahead and use the applicators to clean around the stoma and the flanges. And toss, toss. Now we will pat dry. Ensuring the patient's skin is dry to maintain their skin integrity. And then we will remove the old ties. Again, making sure to stabilize the trach. And we'll toss these in the trash. And we will replace it with a one-time method. And when we tie it behind or run it behind the patient's neck, we're going to want to make sure that it is completely flat, again, to maintain their skin integrity. Okay, and we'll tie it in a knot. We will make sure that the knot is secure and that we can fit 2 fingers beneath, so that's not too tight. We will place the new dressing. I think I was supposed to do it before. And then we will place another gauze folded into a square underneath the knot area to protect their skin. And then we will also tape it down, making sure the tape does not touch their skin. So then we will we will get rid of all of our contents into the trash, perform hand hygiene, make sure their bed is low and locked and they're in a comfortable position with their cot light accessible. Thank you.